Greetings and welcome to Ask the Doc. I'm your host, Adrienne Houghton. Now, each week I talk to medical officers, doctors and nurses who are working with Neurox, a comprehensive psychological and neurological care portal that is both web and app-based. Today, I'm being joined by Chelley Hellmers and Dana McCarron, both from Pioneer Medical Group. Welcome, ladies.
Thank you for having us.
Now, Dana, the first thing I have to say is please tell me a little bit about yourself.
I am the Director of PostAcute Services for Pioneer Medical Group. I've been with Pioneer for about 3 years. I work very closely with our clinical team, overseeing operations of the program and fostering relationships and new business.
So can you explain more about that role and how it links with Neurox?
Yes. We currently provide post-acute services between our physician and nurse practitioners within skilled nursing and long-term acute care facilities. And we are able to connect by Neurox and provide multi-specialty services in collaboration with you all, so these patients get continuity of care without having to leave the facility, which is sometimes quite impactful to their well-being when they're uprooted from the facilities. It's outstanding.
Yes, and Chelley, the same questions to you. Tell us a little bit about yourself and your role within Pioneer.
Sure, yeah. So I've been in acute hospital medicine for my entire career since 2009. And over the past year and a half, I've been with Pioneer Medical Group. We're based out of Tampa, Florida, and we have hospitalists within acute care. And like Dana said, we also really cover the whole spectrum and continuum of care from outpatient to inpatient in the hospital to post-acute. So my job as AVP of Strategy and Innovation is to really make sure that all of the different pieces and services and specialties that Pioneer provides, we're doing efficiently and effectively and caring for our patients with the best care possible.
And back to Dana, long-term care is available in the home. It's also in nursing homes and many other places. How do you actually work out what is the best for the patient, number one? And number two, when do you make that decision for them to go to long-term care?
This is decided prior to discharge of the patient at the time of the hospital stay by the physicians. Depending on the needs of the patient, it's decided whether they would best fit for long-term acute care, where they need medical care for an extended period of time. And the skilled nursing facility is more appropriate for those patients who are on a short-term rehab care model.
And I mean, it must be really difficult. Are you also dealing with some of the relatives of the patients as well as the patients themselves?
Absolutely, and that's where Neurox comes in. That's where the smart clinics is really beneficial to the family members, because if the doctors at any time would need to involve the family member, they can link them in immediately, which is pretty important in the well-being of the patient and the plan of care. It's great to involve the family.
And Chelley, talking about smart clinics and a point of care, can you highlight some of the features that you have?
Yeah, absolutely. So like Dana said, this technology and tool has been essential for us, especially during the pandemic, so that our physicians and nurse practitioners can communicate not only with the patients, but their other caregivers and their family members and loved ones. So with limited visiting hours and availability in both our post-acute locations as well as our hospital, we haven't been able to have the family members and caregivers as involved in the care of the plan care and also like the discharge planning. So this tool has really helped to include them virtually in a way that they can help make some of those decisions along with our physicians and their medical team.
And what's actually the difference between smart clinics and PointClick Care?
PointClick Care seems to be the popular EMR platform that most of the skilled nursing facilities are using. So that's their hub where they keep their documentation. And by integrating it and being able to just have that information at the ready, it's just continuous care, seamless, really. So it's a good benefit.
Yeah, absolutely. And how do you find that collaborating with Neurox helps to continue the care of the patient?
I think really, and from all, probably all aspects of care, and no matter what the specialty or whatever care is needed, it really impacts the ability to avoid readmission to the hospital at certain points, depending upon the condition of the patient. So this, I think, really is very impactful to the hospitals itself, to the patients. I just think it works well.
It's being kept in contact, and you feel as though you're connected all the time.
Absolutely.
Well, and we also use it through the whole continuum of care. So we use it from the time that a patient comes to the emergency department and they might have symptoms of a stroke. If we need to have a neurologist evaluate that patient in a timely manner, and maybe they're at one of our more rural locations or hospitals, we can have a neurologist on call and available to use the technology and evaluate the patient, read their scans, review any of their diagnostics and the patient through the camera in a virtual environment. And then, you know, like Dana said, if they get discharged to the post-acute location, we can also use it there. And then we also use it in our ambulatory environment for follow up with our nurse practitioners, especially those patients that might not have health insurance or a primary care physician. We can use smart clinics and Neurox for that as well.
How groundbreaking has this been? I mean, especially under the current circumstances. I'm assuming that without this facility, it would have been very difficult to do what you're doing.
Yeah, I think that we started doing this in a smaller capacity before the pandemic, and then obviously the past year or so has really increased the demand for this type of technology and these services. We've been, you know, hit hard with a demand for healthcare, and we've had a lot of challenges logistically to deliver that. So this really has been instrumental, I think, for us and our patients and our physicians to be able to continue to deliver that quality care and stay in touch with the patient's care team and families.
Yeah. And long-term vision for the collaboration between Pioneer and Neurox, what do you see for that?
I see a long, successful relationship. I don't think that telemedicine, of course, as we know it, there's been more demand, as Chelley was saying, and I think it's just become part of the new healthcare, and I don't see it going anywhere. I see us having a long, successful relationship.
Yeah,
it's very useful.
And you know, there were the days where we would go to you know, the store to rent a video for a movie, and now, you know, we all have the luxury of the internet and being able to see movies right now in real time on demand that are even still in theaters, and that's just become part of the norm for us. I think that healthcare is starting to move in that direction, and I think that this past year has kind of helped us all become a little bit more comfortable with it. And I see this relationship, like Dana said, growing and becoming national.
Well, I think especially as it's not just web-based, it's also app-based. Nearly everyone has a phone, and so to be able to access the portal through their phone is magnificent, and it means you have instant connection. And I'm sure some of the patients feel that that's a wonderful way to go. So thank you for coming on today and talking to us about your wonderful collaboration with Neurox. It's great to meet you, and good luck for the future.